So we're going to start. Okay guys, so in this video I'm going to be going through room 4, which is going to be assessment room number 2. This is the room where the client has a condition coming in and complaining about it, and then you need to do your orthopedic tests and your assessments in order to find out what is going on with the client, and at the end give them your clinical impression. So we're going to go through a series of steps, and I want to just review it before I start. So the first thing we're going to do is going to be palpation and observing the area that the client is complaining about. The second step is going to be going through the range of motion, all range of motion, active free, passive free, and active resist. Number 3, we're going to do the orthopedic tests. And number 4, we're going to do all the neurological tests, which is myotones, dermatones, and deep tendon reflexes. And at the end, you're going to give the client one clinical impression. Please make the clinical impression at the end. This makes it easier for the examiners to understand, for you to understand what's going on, and for the clients to be able to understand. Please don't give clinical impressions as you go through each step. That will confuse the examiners a lot. It will confuse the client, and you will get confused as well. So just wait until the end. You make one clear clinical impression, and you also must explain to the client what the condition is. So you can't just say you have piriformis syndrome. You need to explain a little bit about what piriformis syndrome is, and then you will be finished, okay? So I'm going to start. So hi, my name is Milad. I'm going to be your student therapist for today. I'm just going to wash my hands for about 10 seconds. How are you doing?
Good.
Good. Okay, so after reading your chart, I see that you have some pain and discomfort on your left hand, and this has happened about 5 weeks ago. So the purpose of today's assessment is to go through a few different physical tests that I'm going to try to find out exactly what is the condition and give you my clinical impression at the end. During the test, if you have any pain, tingling, or numbness, please let me know and I'll stop right away, okay? I will be always standing next to you for your assistance as well. Do you have any questions before we begin? No? Okay? Good. So I'm just going to observe the area first. Can I just get you to put your palms up? Okay? Very good. So I'm just going to palpate to check the temperature. Guys, when you're checking the temperature, you're going to use the back of your fingers to check, not the front, because the front is hotter, okay? So I'm just going to check the temperature. The temperature feels the same. I don't see any swelling or redness. All right, I'm just going to palpate generally. Any pain or discomfort right now?
No.
No? Okay. Any tenderness? No? Okay. Nothing?
No.
Okay. All right. So, thank you. What we're going to do is we're going to go on to the next step, which is going to be your range of motion. In this test, I'm going to get you to do 3 different types of movements. One is a passive relax. So I'm going to do the movements for you. The second one is going to be an active resist, where I'm going to get you to do the movements against my resistance. And the last one we're probably going to do is the active free. So you will do the movements while I'm doing it at the same time, okay? So we're going to start. Again, if you have any discomfort or pain, let me know. We'll stop right away, okay? So can you just put your palm up? Very good. Can you bring your wrist in? Any pain or discomfort?
No.
Okay. Take your wrist backwards. Any pain or discomfort?
No.
Fingers towards yourself. Any discomfort or pain?
No.
Fingers away?
No.
Okay, great. So this time I'm going to get you to relax. I will do the movements for you, okay? Thank you. So here, any pain or discomfort?
Yeah.
Okay. What is it that you feel? Is it pain, tingling, or numbness?
I just feel a little bit of tingling.
Is it going into your fingers?
Yeah.
Okay. So guys, one thing very important. When the client feels pain, right away stop and ask them what is it that they feel. Try to get more information from the client to confirm what the client has or what the client is feeling. This will give you more confidence because now you know generally what they're going to be complaining about, and also it gets the client to tell you, which makes you feel more relaxed, okay? Don't just rush through it. If you miss this step, it will cost you because later you don't know what the client felt. Was it pain or was it numbness? These conditions, each of them, if it's pain or if it's numbness, can mean different things. So it's very important to ask. I will continue. So, any pain or discomfort?
Yes.
Okay. Is it the same thing?
Yeah.
Can you scale the pain from 0 to 10?
Like 3 or 4.
3 or 4, okay. So how about this? Any pain or discomfort?
No.
Okay, how about here? Any pain or discomfort?
No.
Good. So this time what we're going to do is the same movements but against my resistance, please. So can you just have your palm up again? So you're going to be pushing against me. Any pain or discomfort here?
Yeah.
Okay. Is it the same type of pain?
Yes.
Numbness and tingling? Is the pain getting worse?
A little bit, yeah.
So what's the scale now?
I'd say 6, 7.
Okay, so sorry about that. Can you push against me again? Any pain?
No.
Okay. Push outwards? Any pain?
No.
Okay. Can you push inwards? Any pain?
No.
Okay. Thank you. Please relax. So I see you have some discomfort in some movements and with some numbness. We're going to do the next thing, which is going to be some orthopedic tests. Here I'm going to be getting you to do different movements. And if you have any pain or discomfort, please let me know again and we'll stop right away. Okay? Any questions before we begin?
No.
Great. So the first thing we're going to do is called the Fallon's test. The Fallon's test is to check for carpal tunnel syndrome, which is going to be a compression of your median nerve. We're going to get you to place your palms back to back and you're going to hold this for about a minute, okay? So please back to back, just like that. Good. So you're just going to wait for a little bit of time. Do you feel any pain, any numbness, or any tingling?
Yeah.
Okay, please relax. Sorry about that. So where do you feel the numbness and tingling? Is it mainly in these fingers?
Yes.
Okay, all right. So we're going to do another test, which is called reverse Fallon's test. It's going to be very similar to this one, but you're going to have your palms together and your elbows out, okay? Again, we're going to hold this for about a minute. Any tingling or numbness again?
Yes.
Okay, all right, sorry about that. So please relax. So both of these two tests are positive. I will explain to you at the end what is the result of them. We're just going to be doing one further testing just to check the areas. This is going to be, so guys, here you already did 2 tests for carpal tunnel syndrome. Both the tests were positive. You could also do Tino's at wrist. That's an option for you. Or you can go to another test. For instance, you can do Allen's test at the wrist to check for the arteries supplied to the hand, okay? So in this case, you don't need to do a third test for the wrist. You've already got 2 positive ones. That is enough. You can do another one just to rule out. So the next test we're going to do is Allen's test at your wrist. We're going to be checking your radial and ulnar artery just to see the blood supply going into your hands, okay? So can I have your hand? Okay. So we're just going to be, can you make a fist a few times? Open and close, open and close, open and close. Okay, make a fist please. So I'm going to just compress the arteries. Open your hand. We're going to wait for the palm to go a little pale. I'm going to release the right artery, which is your radial artery, okay? Again, can you make a fist a few times, back and forth? Make a fist. We're going to compress the artery again. Okay, open your hand. We're just going to wait for a second. All right. So, the artery supply, or the blood flow going into your hands, both seem to be normal, okay? The radial seems a little bit stronger than the ulnar one, but both just seem to be fine, okay? So the next step we're going to go to is going to do some neurological testing. So I'm going to get 2 cotton balls, okay? So just 2 cotton balls, and I'm going to get you to place both your hands facing up, okay? And I'm going to be touching you with the cotton balls, and you're going to feel this sensation, and you're going to let me know if both sensations are the same, okay? Now guys, for you, what I want you to know, when you're doing the neurological testing for the dermatomes, where do we start the dermatomes from? If the client's condition starts from the wrist, we will go from the wrist down. We don't necessarily need to go from the shoulder all the way down. Why? Because the condition starts from here. That means from here onwards is affected. It doesn't mean that it goes up. Most of the cases, in 99% of the cases, the conditions always go down, okay? In some maybe rare cases, it will go the opposite way. So always check from the area that's affected downwards, not upwards, okay? And it's very important, because there's a nerve involvement, you check every single finger for the dermatomes. That's very essential. Don't focus about the shoulder, because that's not where the client is complaining about. So palms up, please. Close your eyes. So do you feel this?
Yeah.
Do you feel this?
Yes.
Are they the same?
Yeah.
Okay. So do you feel this?
Yeah.
Do you feel this?
Yeah.
Are they the same?
Yeah.
Do you feel this?
Yes.
Do you feel this?
Yeah.
Are they the same?
Yeah.
Perfect. Palms down. Okay. Do you feel this?
Yeah.
Do you feel this?
Yeah.
Are they the same?
Yeah.
Do you feel this?
Yeah.
Do you feel this?
Yeah.
Are they the same?
Yeah.
Last one. Do you feel this?
Yeah.
Do you feel that?
Yeah.
Are they the same?
Yeah.
Perfect. Okay. Relax, please. So the neurological test seems to be normal for your sensation. The next thing we're going to be doing is a myotone. So I'm going to get you to do different movements. So can you please do this movement? Okay. Can you do this movement? Very good. Can you thumbs up? Very good. Fingers apart. Terrific. Okay. So guys, for the myotones, you don't need to necessarily resist it. And we don't need to ask the client, do they have pain or not? Why? Because we don't care about the pain. We only are focusing to see, is the nerve connected to the muscle and are the muscles able to make the movements? That's the most important thing we are focusing on. We don't mind if the client has a little bit of pain because we are not checking the muscles. We are checking the nerve system, okay? So the last thing we're going to do is a deep tendon reflex to check the reflexes of your body. I'm just going to get the orthopedic hammer. So here we don't have a specific deep tendon reflex we need to do, but we could do the brachioradialis or we could do the biceps brachii as a general thing, okay? So I'm just going to get your arm, please, okay? So I'm just going to give a gentle tap to the area. Can you look away, please? Thank you. Just relax, okay? So she has a reflex here. That's fine. And I'm going to check the other side too, please. Look away. So we have a reflex here again, all right? Perfect. So we're finished with all our orthopedic tests, and I would like to give you my clinical impression. So based on the palpation, the range of motion, the orthopedic tests, and also the neurological tests that we have done, my clinical impression is that you're suffering from carpal tunnel syndrome. Carpal tunnel syndrome is a compression of your median nerve. This sometimes happens when you are overworking your fingers, such as text messaging or doing very fine detail work with your hands. This condition is treatable by massage, and massage is helpful for this condition. Okay? Do you have any questions?
No.
Okay, thank you very much for your time. We're finished for today. So then I will wash my hands. So what happens here, guys, some conditions such as carpal tunnel syndrome, you can say that massage is beneficial or helpful for it because it does help. You can do a little bit of friction, you can do some trigger points, you can do some myofascial work, some stretches and things like that. Okay, so the conditions that are treatable, not necessarily treatable, I don't want to use the word treatable, are beneficial with massage. I will give you guys the lists in class and you will know exactly which ones they are, okay? So hopefully I have covered everything. I did stop a lot to pause and explain all the details. So hopefully you guys have picked up on all those details because they were important. And you can see that this room is easy to be done in less than 10 minutes. You just need to know exactly what you're doing. Follow the order that I mentioned. So first we have to do observation and palpation. Then we need to do the range of motion, followed by the orthopedic test, neurological testing, and at the end you give your clinical impression. So this way it's easy to understand from the examiners and from the client's view. Okay? Thank you guys.